Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Hey, docs, welcome to another episode of Modern Chiropractic Mastery. This is your host, Dr. Kevin Christie, and today I am excited to bring on Kristi Hudson of Chiro Health USA. I should have had her on many years ago. It's a topic that we just haven't discussed on the podcast, and we need to. And we're kind of having a little bit of a run here on compliance, certain things like that, how to optimize your practice in certain ways that may not be marketing and all the stuff that you see out there that you're attracted to maybe. But we're going to dive in today, which is something very important. This is honestly, it's your billing compliance. It's like avoiding the dual fee schedule, how to have prompt payment discounts, and there's certain things you can do and you gotta watch out for. And my goal for every chiropractic practice is to do well for itself and do it the right way. And sometimes it's, maybe not understanding what you can and cannot do. Sometimes it's maybe just being a little bit on the lazy side. Sometimes it's hard, it's frustrating, it's like it should be easier, but there's a lot of things we have to be compliant as a healthcare provider, and what you're billing your patients and charging your patients is a big aspect of that. And so we dive into today. We give you some really good solutions. I should say Christie gives you some really good solutions. And, Chiro Health USA has just been doing this for many years and doing it with, I was very surprised to hear the number that she shares, how many clinics that they do work with, and their service does help avoid many of the traps that we fall into as healthcare providers from a billing standpoint, like the fee schedules and that stuff. So we dive into that today. Before we get into that, I just want to remind you, we do have openings for the West Mastermind in 2025. It's going to be really good. I'm excited about the lineup we have for the West. The very vast majority of our current members in 2024 are coming back for 2025, and we're going to be adding some people to that. And we will have Dr. Mark King speaking to us in weekend one. We got Dr. Holly Tucker speaking in weekend two. We've got Dr. Brett Winchester speaking on the it factor in practice, not necessarily the clinical side, but all the other things that he's doing in his practice to have such a big and successful practice. And then weekend four will be a meeting of both the East and West Mastermind groups in New Orleans. And we're bringing in the Great Game of Business. You can look that up, the Great Game of Business. It's a phenomenal business structure. And we just want to spit out phenomenal chiropractors, not only clinically, but also understanding business and doing it in a way that inspires your team and helps everybody grow. And the Great Game of Business is a big part of that. And we have also Jay Greenstein speaking there on all things technology and AI. That will be up to date as of that, late 2025, because it's ever changing. And then I'll be speaking that weekend as well on marketing. And so check that out. Just go to modernchiropracticmarketing.com. You will see a tab for Mastermind, and you'll see a couple different years. We have East and West, but check out that West group there and feel free to reach out to us if you are interested in joining us in 2025. It is an investment. It is a high-level mastermind, but you will get a return on your investment and a return on the relationships you form in that mastermind. Without further ado, here is my interview with Kristi Hudson. All right. Excited to have Kristi Hudson on the line here on the podcast. It's someone that I've gotten to know over the last year because we spoke at Jay Greenstein's event, and that was fun and we had a good time. And it's kind of a shame that I haven't had you on the podcast before. We've been at this for 7 years, and this is a topic that a lot of chiropractors should know about, and they should hear it from you. And so before we do dive into it, tell us a little bit about yourself.
Hi, everybody. My name is Kristi Hudson, and I'm the Vice President of Business Relations at Chiro Health USA. And outside of our founder, Ray Foxworth, I'm the longest employee we've ever had, their very first employee. About to be there 15 years, which is mind-blowing to me.
That's awesome. How long has the company been around?
16 years.
Oh, there you go. Perfect. Sounds about right. Sounds about right. Because I've been out 19 years, and I kind of remember when I first started hearing it, which that makes sense for sure. And then for the sake of brevity, we can call it CHUSA now moving forward, right?
We can.
I
Do
like
you
that.
choose that?
Do you choose? The other thing I wanted to say is you guys have like the best booth at events. Like when I was at in the FCA Orlando last year, I mean, I don't know who comes up with the ideas and how that works, but it's awesome. Kudos.
It thank you so much. Believe it or not, we just randomly talk about it, like what will be our next theme, and then trying to top each other. And last year's booth, which was sports related, was from our accounting manager. She had a dream.
Yeah.
And that's where it came from. And then this year's is a motorcycle theme, and it came actually out of a joke. But I was like, oh wait, and we were going to be the Daughters of Anarchy or
Oh,
something.
that's great. That's great. I love it. Yeah, creativity is awesome. It stands out. I mean, I even brought it up a year later on a podcast, right?
Well, I love
Make you
it. That makes me feel so good because we do put a lot of heart and soul into those themes. And how do you tie sports? Well,
yeah,
sports is easy. How do you tie motorcycles back to chiropractic?
yeah, yeah. No, it's great. It's awesome. And then you kind of said it before we hit record, and I wanted to kind of reiterate a little bit before we dive into it. How many clinics are you guys working with now?
Over 7,000.
That kind of blew my mind when you said it. I was like, did she say 700 or 7,000? That's incredible.
Yeah. I want to say, well, I don't know how many clinics that is. It's over 7,000 providers.
Doctor.
So
Okay.
those
Yep.
are multi-D
Hmm.
clinics. So I think we have right around 1,000 non-chiropractors who work in chiropractic
Yep.
offices, whether they're like nurse practitioners,
Mhm.
PT, things like that.
That's cool. Awesome. Good stuff. And then what is CHUSA?
Oh, I love this question. Uh, It is an effective way for you to implement a profitable discount strategy in your practice. As you know, chiropractors, sometimes that DC stands for Doctor of Creativity, and it really shows when we're trying to attract new patients into the
Yep.
practice or make care affordable. In
Mhm.
chiropractic, unlike everything else in healthcare, we see our patients more frequently than any other healthcare provider.
Mhm.
A dentist see it twice a year, your eye doctor once a year. If you have an issue, you might see a general practitioner 3 to 4 times a year. I'm going
Mhm.
to see my chiropractor 3 times in a week if I'm having an issue, 12
Yep.
times in a month. And so we get really creative in the way that we offer discounts in practice.
Mhm.
I've really been talking a lot around the country about social media advertising
Yeah.
lately and the pitfalls that we make with new patient specials. And
Mhm.
unfortunately, we work in the second most regulated industry in this country, and you can't just say, my $500 new patient visit is $99 without violating a host of rules and regulations. But
Mhm.
Cover Health USA is a discount medical plan organization, which originally were started by insurance companies. We're not owned by an insurance company, we're owned by a chiropractor. And it allows you to legally offer discounts outside of what we're legally allowed to do because it's
Mhm.
now part of a contract. So it's very similar to like an insurance contract with a lot without those restrictions and the negativities because we're not going to dictate what you're going to get paid.
Yeah, and I want to chat about something before we dive into that a little bit. Is a chiropractor can offer a time of service discount, but isn't that about 15%, give or take? Is that?
It is. I mean, it can be somewhere between 5 and 15%.
Yeah.
One of the caveats to that is that it needs to accurately reflect your bookkeeping savings by not having to collect in arrears and bill the patient afterward.
Yep.
And most chiropractic consultants will tell you that the average bookkeeping savings in a chiropractic office is 7%. And if just thinking of an adjustment, forget about any
Mhm.
other service that a chiropractor offers. But a 7% discount, even a 10% discount on an adjustment, that is not saving anybody any money. That's not making that care affordable.
Yeah, exactly. That makes a lot of sense. And I just wanted to get that out of the way there as far as the time of service discount. And again, just for clarity's sake, This is a little bit of a selfish episode too. I'm learning myself. I got a good beat on it, but I want to make sure that everybody's clear. Because some people ask how that works, and you mentioned, let's just say I'm just going to make up numbers for sake of ease. Something is $100. You bill that Blue Cross Blue Shield plan $100. You have a contract with that Blue Cross Blue Shield. They pay you $42. That's a contract you have with Blue Cross. Obviously, that's a highly discounted amount they're paying you based on what your fee is. Now you might bill that same $100 to auto insurance in the state of Florida and get paid $98 of that. It's the same fee. It's a different rate you're getting paid because, again, it's a contract. Now you go and you offer that same $100 fee service to a cash patient, but you charge them $60 cash. That's your cash rate. That, doing good math, is a lot more than a 10 to 15% time of service discount. And unfortunately, probably puts you into that dual fee schedule, correct?
It absolutely does. We always joke that, in the South, four-letter words are bad words, and cash is a four-letter word.
Yes.
Especially when it comes to offering discounts. I'll add that free is also a four-letter word.
Yep.
We never want to do that. And it's interesting because I have that question asked a lot. They're like, well, why is it okay for Blue Cross Blue Shield or another insurance company to pay me less than my actual fee? And it's because you have a contractual discount. You signed a contract and you agreed to that lesser fee. The cool thing about the DMPO or CHUSA is that we use that same contractual model to be able to do the same thing to help you to have a lower fee. But I
Yeah.
think the most important aspect of all of that is we do want to make care affordable for our patients.
Hmm.
Absolutely. We want to expand access to chiropractic care around the country. But at the same time, we want all of our chiropractic offices around the country to be successful and profitable. Because if
Yeah.
you're not profitable, you're not going to stay open. You can't treat your patients. And so helping chiropractors understand the
Hmm.
difference between offering a discount, but still maintaining profitability to keep their doors open and for them to be successful in practice is our number one goal.
Yeah, absolutely. And this is a great way of doing it. And so I want the audience thinking of it. This is essentially like signing um, an insurance agreement with a patient. It's not insurance, but it's a similar type of legality that now allows you to charge that $60 to that patient, even though you charge $100 to the personal injury insurance. Correct?
Oh, absolutely, because it doesn't change what your actual fee is. Your fee is
Correct.
your fee is your fee, so it's still
Yep.
$100. And the great thing, and I love that you brought that up with personal injury, which
Yep.
is big in a lot of parts of the country. I know it's big
Yep.
in Florida.
Yep.
Here's the thing: is that when you have those cash fees and you are billing personal injury, this is the number one hiccup that gets chiropractors on the stand in a deposition, is because
Yep.
they will ask you, "What is your cash fee?" And
Yep.
they'll wanna know why you're charging cash 60, but you're
Mhm.
charging Geico 100.
Mhm.
And it will actually have them they will legally reduce your fees right there on the stand, and you can get in
Mhm.
so much trouble in those situations. There was a consultant that I used to work with years ago, and one of the ways that he used to part of his training and consulting was he would have people go through that practice depositions or practice being on the stand and having to defend their fees, and that was the
Mhm.
part that tripped them up every time.
Yep.
But the great thing is when you say, "Oh, well, no, our fee is $100. Do you ever charge less?" Only by contractual discount, mandated fee schedule, those kinds of
Mhm.
things. They can't arbitrarily reduce your fees right there because why wouldn't you wanna get paid $98?
Yeah, and then the other thing on the flip side, I've talked to chiropractors where they end up, since they're, let's just make up numbers again, their cash service is $75, and then they have auto insurance come in and they only bill out a certain amount, and they're not getting a lot of money. They're not getting paid well from the auto insurance because they're trying to abide by what their fee is. So they actually are selling themselves short on what they could get paid from their auto insurance. Because the reality of it is like, for some states, auto insurance is the only thing left that actually pays us what we're worth.
That's such a great point, and it's really interesting. It's one of the things that I talk about when I'm talking about valuing your services and being aware of what is the market value. Because you're right, in a lot of states, that PI fee schedule is absolutely one of the highest, and in
Mhm.
many states, workers' comp is also pretty
Yep.
high, and it's really interesting that so many chiropractors don't pull those fee schedules. They're like, "Well, I don't bill enough PI or don't bill enough workers' comp." It doesn't matter if you don't bill enough. If you bill it once, why would you not look at that?
Yep.
One of the working with state national associations, it's very interesting how much time is spent, especially on the state association level, where they're battling workers' comp to not reduce those fee schedules. They're battling to make sure the PI fee schedules aren't reduced because 80% of the chiropractors in the state don't even charge what is allowed. So why
Mhm.
would they want to continue to pay you $100 for an adjustment when you're willing to always bill them 60? They should just lower the fee schedule.
And I'm glad you brought that up too, because they do learn from what people are billing. And if you're not billing enough on your fee schedule because you're trying to mitigate this or navigate this whole thing with the cash, then they just continue to reduce the fee schedule.
They do, and that's interesting is because, as you know, we're in a lot of the same, social groups where one of the topics of conversation that comes up all the time is that insurance reimbursement is continuing to diminish.
Mhm.
And people want to blame insurance companies. Why don't they pay as much as other healthcare providers? Well, have you ever looked at an EOB from another healthcare provider? They're
Mhm.
using the same exam codes that you're using. Just comparing exam codes where they have the same documentation requirements, they have to do everything is the same. What they're required for to get paid is you, even if it is a different healthcare provider. Yet they get paid 2 to 3 times as much as a chiropractor. Well, their actual fee is market value. Yours is a third. So why would they pay you more? They're not going to pay you more when you're always willing to accept less. And I
Mhm.
think that a big point is like we'll never change the reimbursement model for chiropractic if we don't start charging market value.
Yep. And then this is a way where you can do that, and then obviously not worry about your patient having to pay $150 a visit for that.
Oh, absolutely, because again, you don't wanna the point of charging market value is, again, it's establishing value, not just for chiropractic services,
Mhm.
but it's to the insurance companies as well. It's to show that we are in line with the rest of the healthcare model instead of making ourselves cheaper. But we do wanna keep care affordable for our patients who don't have the benefit of insurance, and they can use CHUSA if they have a high deductible or one of those crazy high copay plans that like, I remember when I started 15 years ago, we had a patient with a $5,000 deductible, and I thought, wow, they have really crummy insurance. That's
Mhm.
great insurance today.
Yep.
And then having them be able to use Chiro Health USA instead of their insurance in those situations. Um, I think the other aspect that I've began to appreciate now that I'm a mother, and I didn't know this, but there are insurance plans that don't allow for chiropractic care or PT care for children under the age of 12. So this was mind blowing to me as
Mhm.
long as I had worked here. But when my son was 10 years old, 5 minutes before my best friend walked down the aisle, he decided to jump from a tire swing and break his leg. And I don't mean like just break his leg. He broke it to
Mhm.
the point he was in a cast for 13 weeks, a wheelchair 5 of those weeks. And at the end of that, we're at one of the best pediatric orthopedic specialists in our state. And I asked him if he was going to recommend PT for my son, who clearly needed physical therapy. And he said, well, Miss Hudson, your insurance doesn't cover physical therapy for children under the age of 12. That's not what I asked.
Yep.
And it was very disheartening to me because one, care for me or my child should never be dictated by what my insurance will cover. And
Mhm.
number two, there is no amount of money I would not pay for my son to get the care he needs. And luckily,
Yep.
I work for a chiropractor and a multidisciplinary spine center with a full PT department, and my chiropractor sent my child to PT.
Yep.
But, so in those situations, care should not be limited by what insurance will cover. Everybody has the right to affordable chiropractic care, and Chiro Health USA helps to make that happen.
I love that. Let's take a break from today's episode and announce our first sponsor. This is going to be Propel Marketing and Design. I've known Darcy Sullivan for years. We've worked hand in hand on my websites. I don't trust anybody else to do this search engine optimization. She does a great job. There's so much to it. A lot of the lingo and the words are beyond my comprehension, but it's just amazing work that she does. And if you're really going to get results with Google, you have to make sure your website is SEO optimized. And I really don't want you doing it yourself as a chiropractor. So you just have to have this type of stuff done. And if you're looking to get more organic online traffic that pulls in new patients, Propel Marketing and Design is currently offering chiropractors who listen to this podcast a free SEO website review. The free review will help you uncover methods that will improve your website and boost your search engine visibility. Head over to propelyourcompany.com/chiropractor and schedule your free SEO website review. You won't regret it. She gets great results. Your website needs this. Your search results need this. Head on over there to propelyourcompany.com/chiropractor to get your free SEO website review. Hey there, chiropractors. Are you tired of feeling like your dream practice is just out of reach? I know how frustrating it can be trying to balance patient care, paperwork, and billing while striving for that ideal practice you've always envisioned. But guess what? There's a solution that can make your dream a reality. Introducing Genesis Chiropractic Software, the key to unlocking your dream practice. Picture this: no more drowning in paperwork, no more scheduling headaches, and no more billing nightmares. With Genesis, you'll have everything you need to streamline your practice and focus on what truly matters, providing exceptional care to your patients. Imagine a practice where every patient interaction is seamless, every appointment is perfectly scheduled, and every billing process is smooth as silk. That's the power of Genesis. Ready to turn your dream practice into a reality? Schedule your consultation with Genesis today and take the first step towards practice success. Don't let the challenges of running a practice hold you back. With Genesis, your dream practice is within reach. Visit www.genesischiropracticsoftware.com/MCM to get started. Trust me, you won't regret it. Genesis Chiropractic Software, because every practice owner deserves to achieve their dreams. I just want to make sure I get something right on here. Now, if a patient has out of network or in network insurance, and it's got a high deductible either way, and they want to go to the CHUSA route, then at that point you do not bill the insurance, correct? If they opt for the CHUSA discount, then you can't bill the insurance, correct?
That's correct. So they
Yep.
just sign a form that says, I'm telling you not to bill my insurance. It's like an insurance opt-out form that we
Mhm.
provide. Now, because a lot of times, again, short of having an appendix removed or giving birth to a baby, you're
Yep.
not going to meet that deductible. But let's just say you do have your appendix removed or you do
Mhm.
give birth to a baby, then they can sign another form that says, now we're going to opt into my insurance because I'm at my deductible.
Yep.
But thanks to HIPAA High Tech, a patient gets to determine, do I want to use my insurance or do I want to use something else?
They can make that decision, which I like.
They
Tell me, like, walk me through, patient comes in, this particular chiropractic practice uses CHUSA, they come in as a new patient or reactivated patient, whatever. What does that look like?
It's super easy. You patient, let's just say it's a new patient, or let's do a shopper call. These are my favorites,
Okay.
right?
Mhm.
How many times a day does somebody ask your front desk, how much does it cost to see the doctor?
Yeah.
All day. And so the great thing is, or the bad thing is we teach our front desk to be shady, right? Because they can't
Mhm.
answer the question. I don't have a crystal ball that says, well, Dr. Kevin is going to
Mhm.
do this. So this is what it's going to be. So you have them say, well, it really depends on what the doctor finds necessary, what your insurance will cover. And they say, well, this is why I'm asking. I don't have insurance, high deductible, blah, blah, blah. No problem. Well, the great news is that we have this great program in our office called Chiro Health USA that you can join today for $49, and it covers you and all of your legal dependents. Now, our typical new patient visit is is somewhere between $300 to $500, depending on what Dr. Kevin does on that visit. With
Mhm.
Chiro Health USA, the most you would pay for today's visit is, in my fake example, $150, but every
Yep.
clinic sets that fee.
Yep.
Would you like a morning or an afternoon appointment? Because
Mhm.
typically when we say 3 to 500, the patient heard 500, they can't afford it, they hang up, they call somebody else. Now I just gave them an option that was less than that 3 to 500. So even with the
Mhm.
$49 fee, they're going to pay $199 today to see a doctor.
Yep.
And now we've given them an affordable option. We spend so much money on marketing and advertising to attract new patients. And a lot
Mhm.
of times, bless their hearts, they do it the wrong way. Because if
Yeah.
you tell people it's $39, $29, $69 for that initial visit, you're setting a precedence for inexpensive care. We never tell them the value of our services. Number one. Number two, is it attracting the right kind of patient to your practice?
Mhm.
But this way, we're saying it's a valued at $500, but we can give it to you today for $199.
Mhm.
And when they come in, they're more committed to that care. And I will say, when we track those numbers when Ray owned a practice, 95% of those patients scheduled and showed up to those appointments.
Mhm. No, it makes a lot of sense. And so you're letting them know essentially what the fee would be, and then with this discount, obviously plan, they're gonna understand that okay, this is a lot more digestible, and so you're talking to them about that. And then let's say that now they come in, they agree to it, I love it. They come in that first visit. Um, there's got to be paperwork. We talked about contracts earlier. What does that look like? How easy is it to seamlessly implement this for the front desk to have that new patient or reactivated patient fill out this information, make the payment of 49? Like talk to me about that a little bit.
Oh, it's so easy. A lot of practices use the QR code at the front desk where the patient literally scans it. They
Yep.
fill in their name, their address, list out all of their dependents, put in their credit card information, and hit submit and show them their card on their phone. If you have patients who don't want to do that, depending on your software, we're integrated in lots of software. But a lot of practices use the iPad and they just hand them the iPad and it's part of the paperwork. They fill it out, sign it, and pay for it right there on the iPad. It takes like a minute and a half to do the paperwork
Mhm.
because all we're asking for is their first name, their last name, their address, their date of birth, and list their dependents. That is it.
Let's take a short break for one of our great sponsors, TrackStat. It is a new type of software plugin for your EHR that combines patient communication, marketing, automation, and statistics with patient and employee tracking. Built by chiropractors for chiropractors, it shows your team what to focus on each day. See patient visit habits, missing information, unpaid bills, insurance collection visit average, and more. Great visibility of data so you can focus on filling your office with your best patients. When you can see what your staff and patients are doing or not doing and take action accordingly, your profits naturally grow. Take TrackStat for a test drive in your office with our free trial. Not a techie, no problem, we can help. To get started on your free trial, visit trackstat.org and watch the demo. That is trackstat.org. And then you mentioned earlier the clinic, the doctor gets to set the terms in there. What are some examples? I remember hearing that you can set like a max amount per that day or that visit. How does the fee schedule look on that when they're signing that?
So the cool thing is that there we do allow for a lot of flexibility. So you
Yep.
can set like a max new patient visit fee, and you
Hmm.
can limit what services are included in that. But
Hmm.
you can do a max new patient visit. So like in my example, I said 150. You can do a routine office visit fee and do
Hmm.
a cap for that. A lot of clinics will choose to do, they see a lot of Medicare or federally insured
Hmm.
patients. So they'll do like a cap fee for like therapy modality only.
Gotcha.
And you can set like a set fee per service. There's lots of
Hmm.
ways to do it. The other really cool thing is for those practices out there that are seeing a lot of families or that are wanting to expand into more families and see more
Hmm.
children or pediatrics, you can set family plans. Um,
Hmm.
this is my favorite part about going through and helping chiropractic offices
Yeah.
is we reviewing their fees and it'll say like 98940 dash baby. And I'm like, "Oh, no, 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 no." And it has a different fee. I'm like, "Please don't tell your
Mhm.
malpractice insurance carrier you do that."
That's
Um,
awesome.
it's like a 98940 is a 1 to 2 region and adjustment. It doesn't have
Mhm.
a size. It doesn't say if under 4 feet tall, you
Yeah.
know? So if it's $100 for the adjustment, it doesn't matter if they're a newborn or if they're 100 years old. It's still
Mhm.
$100. but we can let you set it up so that you can set up a family plan for children, and you can do it by age, or you can just do it like child 1 is this price, child 2, child 3, child 4.
Mhm.
The great thing is when you work with as many practices as we have, Heather and Ginger can say, "What are your goals? What does your demographic look like? What are we trying to
Mhm.
accomplish?" And they can help you to set that up so that it fits your practice model.
That's great. And I like that. And then it's $49 for the family. It's
Mhm.
per year, correct? And it auto renews at that year.
So it doesn't auto renew. About
Mm.
60 days before it would expire, the patient gets an email that says, "Would you
Mhm.
like to go ahead and renew?" And they can do it online, and it sends you a notification to let you know the patient renewed, or they can
Yep.
renew in your office, which you'll also get a notification that they didn't renew online. But I would say probably close to 40% go ahead and renew from the email.
Perfect. And then could you choose as the clinic to pay the $49 and build it into your fee?
Unfortunately, no.
Mhm.
Again, we're regulated by the Department of Insurance, so just
Yep.
like insurance companies, your patient, there's those crazy HSA rules and insurance rules, and DMPOs have those same rules. So the patient
Mhm.
actually has to pay the membership. However, if they do have, yeah, so they have to pay the membership and sign up for the program to get the discount.
Yep.
Doctors ask us this all the time, but the bottom line is, why would you pay the $49?
Mhm.
That's
Yep.
it's not a good business decision for the
That makes
doctor.
sense. Just had to ask that one. Now the hard one. The practice has been out of compliance, let's say, for example, and they've been, doing things like a lot of practices probably have been doing it, and they say, you know what, we're gonna clean this up, and we're gonna implement CHUSA, and we're gonna make sure we are doing this the right way. How do you retroactively get patients that were getting the discount before without paying anything to now pay something for the same discount and navigating the fact that you're admitting that you were out of compliance for a period of time there? What does that look like?
Oh, it's super easy. So if you're the patient coming in, you've been getting my 50% discount all this time, I would say,
Hmm.
Kevin, we've recently been made aware of state and federal rules and regulations that prohibit us from giving you the discounts you're used to receiving. I'm not sure you know, since you've been a patient for such a long time, that the actual fee for the services that you're receiving are $100. Now, I know you've been paying $50 a visit for the last decade. The great news is to ensure that you continue to get the same affordable care in our office, we joined a program called Chiro Health USA. So we're limited on what kind of a discount we are able to offer to only 10 to 15%. We know that's not beneficial to you, but with Cover Health USA, you can still get that same $100 service at $50. It is going to cost you $49 a year to join, but the great news is, Kevin, it's now going to cover you, your wife, and your beautiful children. So you'll all continue to get a discount in our office.
Can you come to my office and do that for me?
Oh, I would love to.
You've done that before. You've done that before. Um, I love it. No, it's good. And then just, good, clear communication with them and just being honest with it, right?
Yeah, when you're not admitting any fault. What you're saying is,
Yep.
"We've recently been made aware of rules and
Yep.
regulations that prohibit us from doing this, and
Hmm.
effective immediately, we have to change it." And I think the great thing about that is because a lot of times when people join us, they literally just became aware of it because they heard me
Hmm.
or Jay or somebody, Evan, speaking at a conference, and they're like, "What do you mean we can't offer a 40% discount to our cash patients?"
Yeah. Now, do like, let's say the clinic implements this, they're doing it the right way now. Does that really kind of cover you pretty well for maybe the years prior? You weren't really doing it so right, but now you're compliant. You've dotted your I's and crossed your T's. I know you're not potentially a legal expert on that, but is it giving you a little bit of grace?
So, no, I'm not a legal expert, but I am a certified professional compliance officer.
There you go.
So here's what I will say is if you ever notice or if you ever sit in one of my classes and you hear me talk about fees, it's never like it's $100,000 fine. It's between 50 and $100,000 or 13 and $25,000. And the reason why there's the gap is because they're going to hit you with the maximum if it's clear you knew you were breaking the rules.
Yeah.
If you have made adjustments because you became aware on this date and you implemented on this date to clean this mess up,
Mhm.
they tend to be more lenient. I'm not saying they always will be.
Mm.
Now, most chiropractic offices are always concerned when we have this conversation, like what happens now. So the great news is NCMIC actually has an audit insurance policy. They partnered with us to create CHUSA Defense.
Mm.
It's cheaper than malpractice, and you can get up to $1 million in coverage, and that will cover your legal fees in an audit situation and fines and penalties. What it doesn't cover is if you actually have to pay back money that was paid to you. But I will tell you, for example, like one of the examples that I use in one of my presentations is a doctor was paid like $30,000 in insurance billing. He violated rules and regulations. By the time they added on fines and penalties and everything like that, that he owed that $30,000 plus like another $200,000 in fines
Mhm.
and penalties. If you have audit insurance, the only thing you're paying back is $30,000. Everything else is being paid by that policy.
That's great. So just for the audience, NCMIC has an audit insurance policy. Look that up. Awesome. Great. That's a phenomenal resource. I want to switch gears a little bit. A lot of practices sell cash packages or payment plans and that type of stuff. With CHUSA, can you have it in there to where if I'm just going to again make up an example, a patient comes in, pays per visit, and your CHUSA allows them to pay $60 for that visit. Um, could you also offer a package of 10 visits that comes out to be $50 a visit instead of the 60 by paying up front at the beginning of like a cash package?
So a lot of it's funny. I know that you recently interviewed, or you recently had Dr. Bosden at one of your
Mhm.
masterminds.
Yep.
So a lot of our mutual clients will do stuff like that. So the way they do is they have it set up in their cash practice software.
Yep.
Essentially, you're using the CHUSA fee, and you can do a time of service discount on top of that because they're prepaying.
Yep.
So you could do instead of if it came out to $60 and you wanted
Mhm.
to do an additional discount, you could do 10 to 15% off of this
Off
600 for
that.
the 10 visits.
So it's like a prepayment discount, correct?
It's like a prepayment discount.
Yep. Awesome. Perfect. Yeah, I just want to do that. Um, is there any allowances within CHUSA or anything as far because I get a lot of this question now because everybody loves recurring revenue, but like a membership model, are you working with that? Is that's a tricky one. I didn't know what the regulations are around that.
So some states allow for a membership model, but here's what I will say. Membership models were created with other healthcare practitioners in mind.
Hmm.
If you look at where the practices, like in healthcare practices that are most successful with membership models, those patients typically don't come in more than 4 to 6 times a year.
Yep.
If you look at a chiropractic office, it just doesn't fit because of how many times we see a patient. If you look at your
Mhm.
average, your PVA for your office and you broke it down, you'd be like, wait a minute, I don't want to get paid $10 a visit because that's how
Yep.
it's going to roll when you do it. It's
Mhm.
really hard to make that membership model profitable for a practice. I get why people would want to do that.
Mhm.
I do because yeah, recurring revenue is fantastic, but this is healthcare. And
Yep.
so if you have a patient that basically is paying for this membership model of 2 visits a month at $100 a month,
Mhm.
but they don't come in for 6 months, you still owe them all those visits or you're paying them back. So it are refunding their money. So there's a lot more legalities. It's not like a gym membership. It's completely different in healthcare.
Yep.
Um, and again, it just we've done the math in a couple of different ways. It just doesn't financially make sense for
Mhm.
like 95% of practices.
Perfect. And I guess the last question, a lot of people are doing add-on services that may not be covered services by insurance. Does that follow the same legalities of dual fee schedule and things of that nature where you still need to, you can't, you can't bill, it can't be $100 fee and then you collect 50 for that, even if it's not covered by insurance?
Yes, it's still
Yeah.
the same.
Mhm.
Absolutely, because whether or not you can bill it into to insurance is that's not even important, right? That's not how you set the value of the service. You
Mhm.
still can't offer more than a 10 to 15% discount.
Yeah.
And there's a lot of reasons for that.
Mhm.
There's that tie into the rules and regulations. I have a group of practices that I work with under one consulting group, and they have an addiction. I don't know how other would say to chiropractic toys. Like, they
Yeah.
love every kind of new machine
Yeah.
and modality therapy technology. And it was funny when I first started working with them, a lot of the stuff that they were utilizing in their practices, I had never heard of. I'm like, "Y'all gotta send me a
Mhm.
brochure. I don't even know how to code this." You still have to code it correctly, right? Even if
Yeah.
insurance isn't gonna bill for it. But we do have special pricing set up for that under CHUSA.
Yeah.
If they wanna do it that way, if they wanna use
Mhm.
CHUSA as an option for those add-ons, and in some cases, especially my neuropathy clinics, like,
Yep.
they have a device and they're like, "I don't wanna offer a discount," and I'm like, "Great, exclude it from your CHUSA fees, but we can offer it on your adjustments and new patient exams." So, there's a lot of flexibility there, and here's what I'm gonna say is, like, the joining CHUSA is super easy, but the very first thing we do is we're not jumping into your discounts other than
Yep.
to say, "What are you doing now? This is a confessional. Tell me every discount you're
Yep.
offering, and then I'm gonna ask you a bunch of questions to dig a little deeper. And then we're gonna figure out what is your cost of doing business? What's my break
Mhm.
even point every time I walk through the door?" Almost every practice we talk to has no idea what that price is. So how
Mhm.
do you set a discounted rate if you don't even know what you have to make to pay your bills and your
No.
overhead?
No.
And then we're gonna do an evaluation of your fees. Like, we're gonna
Mhm.
help you see what is the market value based on your zip code in comparison to every other healthcare provider in your area and see how far off you are. The average practice we work with hasn't adjusted their fees in 7 years. And
Mhm.
Kevin, I mean, we don't have to tell people that the price of everything has gone up significantly in the last since the pandemic alone,
Yeah. Yeah.
right? So which means you're seeing the same amount of patients, you're collecting the same revenue, your expenses have gone up, your profitability is down. So we're gonna right that ship, and now we're gonna talk about discounting
Mhm.
your fees to make care affordable for your patients. Which is probably why our most of our practices, like the average increase in revenue once they implement, she said the average is 20%. There are some
Mhm.
that are significantly more than that.
Yep. That's awesome. This is great. Anything I didn't ask you or anything that you feel like they really need to know, the chiropractor listening to this?
Here's what I'm gonna say. Most chiropractors think, "Oh, this is something new that I have to
Mhm.
implement in my practice."
Mm.
Listen, let's just all admit change is uncomfortable, do
Mhm.
anything different. But the bottom line is that if you keep doing things the same, you're gonna get the same results. If you're
Yep.
not sure if you need Chiro Health USA, then just set a consult call. Like, we're not hard sales. We'll tell you exactly
Mhm.
how to fix it without using us.
Yep.
It means charge your actual fee. We'll still help you even figure out what that fee should be.
Mhm.
Number two, if you want to use this will be the easiest thing you ever implement in your practice. And I'm not saying that like from me. I am saying that because that is the feedback that we get from
Mhm.
all of the clinics. And I mean, the office managers, the doctors, the CAs. This is the easiest thing we ever implemented into our practice. So what
That's
do you have to lose? And it's free. It's free to
that's
the practice.
that's great. And I want to go back just real quick, and then I want you to tell us where they can find more information on it. But I forgot to ask, if let's say you're out of compliance, you get CHUSA, you're in compliance. Should you document that, like the day, like we've implemented this, where like should you just document it? Would that help you out as
Yeah, I
far
think
as
you should document it in your compliance manual.
manual? Right.
Yeah, if you have one, if it's still in the plastic on your shelf, just ask us about that. We'll help you fix that too. Um,
You have compliance manuals for us?
oh my gosh. Well, we own multiple companies, and one of them is
Yeah.
a company that will actually do your compliance program for you, and they'll document all of
What's
that.
the name of that company?
Cairo Armor.
Oh, perfect. Okay. Another good resource. We're going to make compliance easy. That's good.
That's so funny because that's kind of like our tagline.
I know. That's why I said it.
You know, because the bottom line is that any time that a doctor spends doing anything other than treating patients is
Mhm.
costing them money,
Yeah.
right? And a lot of times, what does a chiropractor do? We make our most dependable team member responsible for compliance without giving them any resources or training on what that entails.
No.
Um, and that's not necessarily the right path either. So why would you not spend a little bit of money to ensure that everything is taken care of and you don't have to be responsible for it?
So let our audience know where they can find more information to make that happen.
So you can go to chiroarmor.com, and we do a free consult on that one too, and an evaluation to
Mhm.
see where you are. Or you can go to chirohealthusa.com, and you can find information under perfectly protected practice on the audit insurance that we
Mhm.
have with NCMIC, Chiro Armor, and Chiro Health USA.
Perfect. And then they can reach out and get that ball rolling and get into compliance. So, hey, this was great. I hope I see you out there on the road. I know you are one of the handful of people that travels even more than I do. So I'm sure I'll see you out there this year.
You will. I mean, at the very least, I'll see you next month in DC for the
That's
Business
right.
Adjustment Summit.
I was hoping you could be there. So I'll see you in DC. And if anybody's listening to this, I highly recommend you go to Jay's event, not because I'm speaking, but because of all the other people that are speaking and just the information and collaborations you get out of it. So hopefully we'll see you there. I think that's June 22nd. And hopefully see you there. And looking forward to it, Christy. Have a great rest of your day.
You too.
I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time-free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth, and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things, and we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.